So welcome to another video. So I just wanted to let you all know to make sure you subscribe to the channel, like the video, share it, and then feel free to watch any of the previous videos that I have done. And yeah, so it also leave comments down below of things you want to see in the future. And I hope you all enjoyed this video. Hello and welcome back to another video. So I hope you liked my last video on the importance of public health, and if you haven't watched that one before or already, I would suggest you watch it before watching this one, just so you kind of get a little bit of an overview of what exactly is public health, and or have a little background before I get into my research. And so for today's video, I'm going to be talking about my research in the area of public health, but specifically my research was on Latinas, or cancer disparities among Latinas. And so the research that I did it at the UIC School of Public Health, and I worked there for 2 years as basically just like a research assistant. And I worked with Dr. Yamile Molina, and she's the best mentor in the world. If you ever get the chance to do research at the School of Public Health, or you're interested in cancer research, I would definitely recommend that you work with her. She's just really great. So I wanted to talk about the different type of projects I was working on while I was at the School of Public Health, and more so like what were the general projects that my PI was working on, and then the projects that I created from her projects, if that makes sense. And I'll go into it more later. My dog is drinking water. Shh. Storm, quiet. Yeah, so I'm going to be talking about the research projects, and just a little bit about what I actually did when I did do research, just because I think it's important to create awareness about the topics that I will be talking about. And I just really enjoyed what I did, and so if you think you might like something like this, please message me, please let me know, so I could help connect you with anyone who's still in the field that I studied. So what's really important to note, I guess in terms of research in general, is that there's so many topics you can do research on, and there's so many different types of research. And so often what I've seen students perception of research, it's usually like what we call benchmark research. And so students tend to think that the only type of research there is like in a lab, and you're using pipettes and dealing with stuff like that. And that is a type of research, but that's not the only type of research there is. Like, there's a variety of different types of research. And so the type of research that I did was very different from that. We were not in a lab, we were not doing science. This was research we did with people out in the community. And I'll talk about the first research project that we worked on, or one of them. It was trying to educate Latina women on the importance of getting their mammogram annually. And so what background research told us, and like when my professor went ahead and did lit reviews and looked at what research was already published, we were starting to see that Latinas were not getting their mammograms as they should, and we were trying to figure out why weren't they getting the mammograms that they were supposed to every year, like once they're the age that they're supposed to get it. And she was trying to tackle various issues. So we created, for that project, there was 2 cohorts, so 2 groups, and one was located, or one would have classes on the south side of Chicago, on the southeast side of Chicago, and the other group was where we recruited women from Pilsen and like Little Village in that area. And so on the southeast side, we had women who were, we would have like these education classes, and we would only educate them on why they are at high risk of getting breast cancer and why they should get screened annually. Versus a Pilsen and like Little Village area, we also educated them on why they should get mammograms annually, and you know why they're also at high risk for getting breast cancer. But we also had a volunteer component where they would volunteer at health fairs and try to recruit other women to get their mammograms, and like they would do a variety of things all within like the volunteer umbrella. And basically the thought process through that was that if a woman has to tell somebody else to get their mammogram, they have to get it themselves, and they can't look like a hypocrite. And so, you know, we thought that the group in Pilsen and Little Village would be more successful than the one on the southeast side who was just getting education, and they weren't actually getting involved in the community, and they weren't necessarily recruiting others to get mammograms. And there is the final project, I think, was published already in like the final paper, and so I'll try to find the link to that and put it down below if you do want to read more about the specifics of that project and how it actually ended up turning out, and what group was more successful in actually getting their mammograms annually. And so that was just one project, and it's one example of what public health research looks like. That research was more so creating these classes where we educated women. So they would go, I think it was for 3 weeks on Saturdays. So it would be 3 Saturdays for the whole like course, I guess, to be completed. And we would teach them again a variety of things, but all concerning breast cancer. We would show them PowerPoints and have them do activities and answer questions. So it was like a class. And I really enjoyed doing that. And so the project that I just explained, that was my, the professor that I was working with, that was her main project. And when you're submitting like abstracts for conferences and things like that, I can't necessarily take her project and present it because that's not my work, but I could make up a question using her data, using surveys that we had passed out, using the materials, the activities that they had filled out in class, and come up with my question that I wanted answered, and then see if the data agreed with me or not. And so with that, I created a question which was basically, I have it written down, it's been I think a few years since I did this project, but I wanted to see what were the barriers that actually prevented Latinas from getting mammograms. And in the class, there was a PowerPoint slide that they had to fill out and be like, okay, did you have this barrier? Like, was this one of your barriers as to why you didn't get a mammogram? So an example would be like, oh, I couldn't call off of work, and that was why I couldn't get a mammogram. Or I didn't have anyone to take care of my kids, so that's why I couldn't get a mammogram. Or I was scared that I might turn up positive, and that's why I didn't get a mammogram. And so it was different reasons like that, and I analyzed those reasons to try to find what was most common among Latinas. And what I ended up finding was that logistical barriers were the ones that actually prevented women from getting their mammograms. And those logistical barriers included work, like not being able to call off of work or not having anyone to take care of kids. Like that whole like scheduling, like anything around scheduling and work was what actually prevented them from getting their mammograms, or what I found was more common. Another project we had worked on was a rural cancer assessment. And so this project wasn't necessarily on Latinas or Latinos, but it was more so on African Americans in rural parts of Illinois. And we worked with CRWG, so it's the Center for research on women and gender, and they ended up creating this assessment that tried to figure out if cancer survivors or caregivers of cancer survivors had their needs met, given the resources that they have in rural parts of Illinois. And so during my time when we were working on that project, I would try to find as many places as I could to like contact so we could give them the survey, and so they can pass out the survey in their community, because we weren't necessarily from the rural parts of Illinois. Like I had never been there, I'm from the city, but we were trying to figure out if they did have the resources they needed. And this was a project we wanted to do because in rural parts of Illinois, things are so isolated. You know, your nearest doctor might be like an hour away, 2 hours away. If you have to get chemo or radiation, there's going to be a lot of barriers you face, including travel time. Like, do you even have a car to use to get there? And so we were just trying to see what was missing in those areas. And later it could be another project where we try to get them all those resources that they do need, if they are cancer survivors or caregivers for cancer survivors. And the third project that I worked on while I was there was one with the Alas Wings Cancer Survivor Support Group. And so the Alas Wings support group is a Spanish support group for cancer survivors. And it's one of a kind because that's literally the only organization that has Spanish-speaking cancer support groups here in Chicago. And I really liked the time that I spent there. I volunteered with the cancer support group, so I would go, I think it would be maybe like the second Thursday of every month. I forgot, but it's been a while. And it was great. They had a lot of stories to tell and a lot of good information to share on how we can improve our healthcare system and how we can understand their experiences more, and like see what help we can provide as researchers and as health professionals to help these Latina women better. And so the project that, again, Dr. Molina created with, again, the help of like other PhD students, it was basically like analyzing their experiences using the ecological model that I talked about in the last video. And so basically seeing how their experience was impacted by all these different levels, such as the type of organizations in their community and different policies that were made, and just a little bit of everything. And so I think that paper is also published as well, so I can again try to look for it, and if you all are interested, you can read that as well. Specifically though, what I did with this, based off of this project, was, so it was a long process, but to explain this project more, we did focus groups, and we would have maybe from like about 9 to 10 women come and tell their stories, and just talk about their cancer experience. And the facilitators, or like including Dr. Molina, would ask certain questions and try to see what their response was, to see if, like, again, any like disparities, anything that they needed help with, or you know, trying to address issues. And what I ended up seeing, we recorded all of these conversations as well. And so what I ended up seeing from just listening to these conversations was that there were women who had positive experiences with their providers, and women who just had terrible, like super negative experiences with their providers or like health professionals. And I wanted to go ahead and analyze why some women had great experiences and why others didn't. And so what I ended up finding out from that project was that women who who didn't have language barriers, women who were able to communicate well with their provider, had the best experience, because there was no miscommunications, there was nothing lost in the process of translating. Any concerns that they had were addressed, they were given the right materials and resources because they were, again, able to communicate and ask what they needed, and things like that. Versus women who had very negative experiences, it was because of a language barrier, it was because they didn't have a good connection or communication with their provider. I think we also found that there needed to be, I have my poster here also for that, shared decision making. There needed to be shared decision making for patients and providers to be satisfied with their care. And that's one of the main important things that I found from this poster, is the importance of having that shared decision making with a provider and with the patient, because these decisions that they're making when they have cancer, my mom called, so the video ended. But yeah, so women are required to make like these extremely important decisions when they're dealing with cancer, and it's super important that they have all the knowledge they need to like make those decisions, but also that they're comfortable with whatever decision they made. And for example, specifically when we're dealing with breast cancer, women have to make the decision, or sometimes they have to make the decision of cutting off both breasts or not, or cutting off one breast. And it may not seem like a big deal, but it really is. Even like things like your hair are really important, and when you're losing your hair through like chemo or radiation and all the treatment that you're receiving, it could be very scary. Like, you start to feel less of a woman, and it's not necessarily like that's what makes you a woman, like your breasts and your hair don't make you a woman, but like it, in a sense, it kind of does. And when they're taken from you because of like this awful disease, it hurts the women. It hurts the women a lot to lose their hair, to lose their breasts. Like, they feel like somebody else. Survivors have said they kind of feel like Frankenstein, because you just see all these like scars everywhere, burn marks from radiation, and you just don't feel like yourself. Like, you feel different, and it's really hard for the women, and that's why it's especially important to have support from like cancer support groups like Alas Wings, or from their physician, and you know, having people along the way to tell them like everything is going to be fine, you're going to feel better about yourself, you're going to look better, you're going to be healthy, and you know, they need that support. And so I'm just going to go ahead and show you what my poster looked like for this research. But this is basically what it looks like. This one was like a lot of words. And so basically everything that I told you was in this poster, including like quotes on the negative experiences that women told, or that I heard in the recording, and along with positive experiences, and then the results and everything like that. But what really, the reason why I wanted to do this research specifically was because of all the negative experience, not all, but the few negative experiences that I heard in these recordings. And so there were patients that, you know, had doctors tell them like, no, you don't have cancer, you can't, like, it's not possible. I think there was a patient who was pregnant at the time, and you know, she felt something wrong in her body, and she felt something was not right, and she was like, you know, like, I mean, I feel like something's wrong with me, and then doctors would kind of just push it to the side and be like, no, it's just that you're pregnant, your body's changing, things are different. And I mean, it makes sense, but also you have to keep in mind that a patient, or like a person, knows when they feel different and when something is wrong, because it's their bodies. And so I think even as much as you want to like push it to the side, just listen. And it honestly could make a difference. And for example, for this patient, like when she was diagnosed, if somebody like keeps pushing it aside as if like nothing's wrong, she's gonna end up getting diagnosed at a later stage. And it could be lethal for her, like it could actually kill her. And so, you know, just always listening to your patient. And that's also why I really like my research, because I feel like it is going to end up making me a better doctor, because I've learned so much from all these patients and cancer survivors and their stories and all the bad things that have happened with their physicians. And it'll teach me to not be that physician. It'll teach me to have some compassion and to listen. Even if I'm tired or I've seen a billion patients that day already, like it makes a difference. And what else? Oh, I had also done another project on how size of social networks impact the knowledge that women have on cancer. And so I was trying to see if like women know more people and have more friends and talk to more people, if they're going to know more about cancer, or are they going to know less? Are they going to be getting wrong information, and things like that. And so what I ended up finding for that project was that, yeah, the more women, or the more people women talk to, the more they know. And it kind of made sense, because if you think about it, if you're talking to a lot of people, eventually you are going to get the right information. If you have a small network of people, like you only talk to a handful of people, these handful of people could all have the same thought process. They could all have certain biases, believe certain things if they're from like the same group, and they could tell you wrong information, and all 5 of them could believe it. If you know you're not educated enough, or just like you're exposed to the same things on social media, and there's a lot of factors to it. But eventually, if you do talk to more people, you're going to get more perspectives, different points of views. And we found that that was better for the women in actually educating them on the right information on breast cancer research, or breast cancer information, or just cancer in general. But yeah, that was also a smaller project based off of surveys that we had passed out in the interventions we did in Pilsen, Little Village, and the southeast side of Chicago. And yeah, I think that's about it. Those were the 3, there was 3 main projects that I worked on with Dr. Molina at the School of Public Health, and from those I made 3 main projects that I presented research on. So this is what I spent 2 years on, these 3 projects. These 3 projects were what brought me my awards, in a sense. All of the awards that I've gotten were based off of these projects. And yeah, if you have any questions on research, or you want to get started on it, message me, let me know. I could help maybe find you some programs, let some people know that you're interested. Yeah, that's about it for today's video. Thank you for watching. Again, don't forget to subscribe, like the video, share it, and let me know what you guys want to see next.